When I was 19, I had an experience that completely turned my world upside down. I had a full time job and my own apartment at the time, and one night I clumsily tripped over my own feet during dinner shift, and that resulted in me breaking my foot. The following months uh, after this consisted of me trying to get workman's comp, trying to get my job to pay for appointments, and just trying to schedule things as well to get my foot healed and back to work. Um, though the aftermath of my broken foot was an extremely difficult journey, I often had thoughts of people in similar and worse situations that I had known. I thought about people trying to work through chemotherapy treatments or the many women that I knew that worked up until their 40th week of pregnancy. Um, I tried and failed what it would be like um, to imagine what it would be like also to have a child with some type of terminal illness and also have to pay for their medical treatments on top of that. Um, we see social media accounts of these families and their hardships all the time, but I had never experienced what it was like to be overwhelmed by medical bills until I had broken my foot. And now I realize it doesn't really even take that much for somebody to go into complete financial ruin over medical bills. According to the Nork Research Center at the University of Chicago, about 40% of Americans report skipping a medical treatment or a test, and 44% report not going to the doctor when they were sick or injured because of cost in 2017. The healthcare system is outdated, leading to shortages of healthcare workers and people not being able to afford necessary care. Today, I would like to talk about some of the reasons why the American healthcare system needs to be completely restructured in order to sustain the growing demand for access to quality and affordable healthcare. Although we have citizens filing for bankruptcy over necessary medical treatments, we also simultaneously have to deal with an underpaid and overworked medical staff in our hospital settings. The current economy simply can't support the business of privatized medical offices and facilities. People living at the poverty level can't be expected to pay for their own medical treatment when providing things like food and housing for themselves or their families is already something that they struggle to manage, especially when the CEOs of these privatized hospitals and medical facilities are making millions of dollars. The obvious wage gap between a neurosurgeon and a McDonald's employee implies the fast food worker would never be able to cover the cost of brain surgery. But why are insurance companies still quick to deny coverage for necessary medical treatments? Oftentimes, people end up submitting to their medical debt and claiming bankruptcy, distributing the financial burden onto other copays, premiums, and deductibles that become higher and higher the more people waive their medical debt responsibilities. We also can't ignore the fact that businesses are understaffed these days, and medical facilities are indeed no exception. And that's not surprising given that nurses are offered sometimes as low as $23 an hour after obtaining a nursing degree to work in a hospital, and even as low as $10 an hour for a home health aide. Um, my boyfriend, who has an autistic son that needs 24-hour care, he had an extremely hard time finding somebody that was reliable, um, that could handle all of his son's care requirements. And he ultimately had to quit his job because, again, the turnover for these companies was also so high that nobody could really sustain their life making $12 an hour working for this home health aid company. So even when my boyfriend did find a good person, they didn't really stick around long. The way people financially benefit from the current cost of healthcare is unsustainable, and we need a new system, perhaps with government support, organizationally and financially. We need to find a way to make we need to find a way to pay nurses without charging Americans more than they make at their jobs. Circling back to the medical bill aspect of it all, people in America really just can't afford to see a doctor. The way we charge people for treatment here is not sustainable, and it contributes to many social issues such as poverty, homelessness, and unemployment. In 2021, the Peter G. Foundation found that U.S. healthcare spending reached $4.3 trillion, or an average of $12,900 per person. With a poverty line of $23,000 per year for a family of three, this means some people are spending a whopping 56% of their income on healthcare. Mathematically, long term, this doesn't work. Relying on half your budget to support your healthcare needs doesn't leave room for anything like wealth accumulation, retirement planning, or savings. The average copay to see a primary care provider through private insurance is $25, and the average copay to see a specialist is $42. I'm sure we can all think of a time when we didn't have the extra $25, $30 that it takes to see a specialist or a regular PCP, and relying on patients to pay these outrageous copays when the federal poverty line for a family of three is $23,000. It really just ensures that financially disadvantaged people in America will not have access to healthcare here. I don't know about you, but personally, I think access to healthcare should be a right and not just a privilege for people who have money. Restructuring the healthcare system could look a few different ways, but it will ultimately need to be done as long as Americans need medical treatment. In some countries, think like Canada, it's mostly paid for in taxes because everyone uses the healthcare system, similarly to our school systems. The way the healthcare maintains itself currently is working for one demographic in America, and that would be the rich. The rich, however, make up a very small section of America, and with the average median income being around $70,000 in the US, the rising inflation is forcing us to decide between going to the doctor or getting half a tank of gas. It's my dream that one day I won't be one accident away from total financial ruin, and I wish that upon everyone else too. The healthcare system in America needs a complete makeover. It needs to be gutted and rebuilt. The people who own these hospitals, insurance companies, and who implement policies could cover many patient treatments out of pocket, while their customers are left worried about their charges, more worried about their charges than what brought them there to these medical facilities in the first place. Depending on the free market American economy to financially support hospital staff isn't realistic, especially when many Americans can't afford basic necessities that cost less than healthcare appointments or medical testing. I truly believe we have the resources and that enough people in both the medical and political fields care about American citizens to fix the way we fund our healthcare system. Make sure you vote for people who have your best interests in mind, leave thankful reviews when you receive great healthcare service, and recognize when we need to change. I hope you all stay healthy, and thank you for listening.